Hi friends. So today I would like to discuss some concepts regarding hemolytic anemia from the general medicine part. So without further ado, let's proceed to the video. Okay. As you see, doing this video, editing it, uploading it, it requires like a considerable amount of time, and I don't have that time or that um, that urge to do something like that, or that interest to do all to go through all those heavy procedures. That's why I prefer these kind of live sessions now. I'll try to upload similar sessions, means do this kind of live sessions in future, but don't know how much I can do that. So anyway, let's start. So I am going to talk about hemolytic anemia. Okay. So hemolytic anemia. What is hemolytic anemia? That's the first thing we have to know. So here, let me tell you, it is a condition characterized by premature destruction of RBC. So we know RBC, RBC, it has a lifespan of 120 days. So in some cases, RBC dies very soon, or RBC won't last up to this 120 days. So in such cases, what happens? In such cases, this RBC will die, means its lifespan will be reduced. Okay, RBC's lifespan will be decreased lifespan. Okay, decreased lifespan. So okay, that much we know. So when this happens, what are the other following events? Like RBC dies, the hemoglobin comes out, hemoglobin breakdown, okay, and heme and globin, it converted to heme and globin, and such things happen. So there will be a process of hemolysis. That's why we call it as hemolytic anemia, because hemolysis is what happens there. Okay, fine. Now about the clinical presentation of hemolytic anemia. So here you can see that this hemolytic anemia, its clinical presentation or clinical features of this hemolytic anemia is determined by certain factors. What are the factors? Let's count them. 1. Severity of hemolysis. What? Severity of hemolysis. Severity of hemolysis. Number 2, the rate of RBC destruction. Rate of RBC destruction. RBC destruction. Rate of RBC destruction. So if hemolysis severity increases, proportionately this clinical features will also increase in its intensity. Okay, and the rate of RBC destruction increases, which means more hemolysis. Okay, so again the same thing. Now another factor you can tell is, see, whenever this happens, we know the destruction increases or production decreases. Okay, and this, if the destruction increases, there should be some compensatory mechanism in our body to compensate for this loss. So that thing happen inside the bone marrow. As you know, bone marrow helps in the RBC production. So bone marrow will try to compensate for this loss, and it depends on the ability. If bone marrow is sufficiently compensating, then there won't be much issue. But if it does not compensate that much, the issue will be more. So third factor I will tell you. So for the third point I will say that it is ability of bone marrow to compensate. Ability of bone marrow to compensate for loss. So three factors I told now. Severity of hemolysis, rate of the RBC destruction, and third one, ability of bone marrow. This one is bone marrow. Okay, this one is bone marrow. Okay, so that's it. So these are the three main important factors which determines the clinical features, its intensity and all. Okay, so that's it. What else? Okay, so next question: how is hemolytic anemia diagnosed? How is hemolytic anemia diagnosed? We are going to talk about the diagnosis. We are going to talk about the diagnosis. Okay, so there will be combination of history taking, physical examination, and the laboratory test like blood tests such as complete blood count, reticulocyte count, peripheral blood smear. Okay, so CBC you can go for. So diagnosis involved. See, there is something which you can write in every answer. So for any disease you can write about, when they ask about diagnosis you can write about history taking. History taking is something which is, you can see in any disease, history taking is very relevant, and history taking itself will lead to the diagnosis of certain disease. And the next thing is what? Physical examination. As you know, for any disease, by carefully examining the clinical features, like this physical examination plays an important role in the diagnosis. So these two things are common for any disease. So any cases you can write history taking and physical examination. So in this case, what we have to study as new is the lab test, because there are different types of anemia. It is essential to know which lab test, which kind of blood test is really helpful in determining the hemolytic anemia. Because see, some tests are common for any type of anemia, but some tests are specific for hemolytic anemia or megaloblastic anemia or iron deficiency anemia. So we have to know the main idea is differentiating the importance of these tests in certain diseases. Okay, so if you have that idea, you will know we know the concept. If you have that idea, we know the concept of all these diseases. Okay, so yes, now what else? So how is hemolytic anemia diagnosed? Then what is the role of okay, I didn't list everything, so let's talk about the blood test. Okay, so the blood test, the history taking and physical examination you should write for everything. Let's talk about a blood test. We'll see all this in detail. For now, just name it. First one, CBC, complete blood count, includes RBC count, WBC count, platelet count, etc., etc. Then you can say reticulocyte count, reticulocyte count. So here comes the question: what is reticulocyte? So I have some you say vague idea, but I can't give that idea to you. So I'm going to Google it for the exact definition. See, I know what you guys will probably be thinking now. See, this is not a lecture video. This is kind of a discussion video, and I don't know every facts and everything regarding any of the topics like this kind of live sessions. Any topics, while I'm talking it, I don't know the whole concept and everything. My point in doing this kind of live session is making use of the time beneficially, both for us, means for me and for you. So that's the whole point of doing all these things. I just want to make use of my time beneficially, and I have to learn concepts, and if I can share with you, it will give me some motivation, it will give some motivation to you also. So that's the whole idea behind all these things. So don't expect so much from me, because I am not I can say that because I am not an expert. I am just learning, just like you all people. And I want to say one more thing. I want to emphasize on a thing, which is this channel is specially for medicos, because whatever I am saying, these medicos, they can correlate with that, they can understand that. Other people, if they happen to see my video, it's okay, they can also learn something. But what I am trying to say is, I am just doing this for the sake of the medicos who prepare for exam. That's it. So it won't meet the requirements of a proper expert video. Okay, just leave it. I'm talking so much, no need of that. Okay, let's focus on the next questions. What is the role of hemolysis in the pathogenesis of hemolytic anemia? This is a very good question. Okay, oh, sorry, I forgot about the reticulocyte. Let me Google it. Okay. Let's see what I can find about the reticulocyte count. Reticulocyte. What is reticulocyte? So just now I found out that a CBC with reticulocyte count is a commonly prescribed blood test that can help doctors diagnose different types of anemia. See how your bone, see I am just reading from internet, how your bone marrow is functioning and help monitor health progress after a patient undergoes severe treatments like radiation therapy, chemotherapy. Okay. So these kind of therapies, they want to see how the bone marrow is functioning. Okay, in certain disease, maybe some bone marrow tumors or something else like that. So anyway, in certain conditions, to assess the functioning of bone marrow, doctors, they used to give, not used to give, they still give this combination of tests, that is CBC with the reticulocyte count. So it can help diagnose in different types of anemia. Okay, so what is reticulocyte? What is reticulocyte? That is important. Reticulocyte. So reticulocyte is actually, wait. Reticulocyte. So reticulocyte. So these are immature RBC produced in the bone marrow and released into the peripheral blood. Okay, very good. So now I think concepts are clear. So when we discussed about the definition, what did we say? When we discussed about the definition, we told that this, like all this happens due to the rupture of premature RBC. RBC is destroyed early in their life cycle. Its lifespan will be shortened. Okay, so here what will we see? In this case, this RBC, okay. So, what was our question? What is the role of hemolysis? No. We were talking about how it is diagnosed, and we have to assess the reticulocyte count. What is reticulocyte? Okay, reticulocyte is essentially what is the premature RBC. The premature RBC. What is reticulocyte? The premature RBC coming out of bone marrow. The premature RBC coming out of bone marrow, that is called a reticulocyte. And now, so that is reticulocyte. So this is the thing. Sometimes we have to assess the reticulocyte count also, because see, as per the definition, immature RBC is broken down. This immature RBC is otherwise called a reticulocyte. So it is essential to assess the reticulocyte count. That's it. Now, what else? I know I am doing this in a very weird manner. It takes much time to explain simple things also. But that's my status now. Let's hope it will improve over time. Now, okay, fifth question. What is the fourth question. What is the role of hemolysis in the pathogenesis of hemolytic anemia? What is the role of hemolysis in the pathogenesis of hemolytic anemia? So this is something which we should know from the beginning. Hemolysis is what? The premature destruction of the RBCs is the central feature in the pathogenesis of the hemolytic anemia. It leads to a decrease in the RBC lifespan, causing anemia. So I don't think it needs much explanation. Next question. What is the result of the damaged RBCs in the pathogenesis of hemolytic anemia? What is the result of the damaged RBCs in the pathogenesis of hemolytic anemia? So, this damaged RBC, what will happen? Hemoglobin will be, so here, this is RBC, let's say this is RBC. So this RBC will be damaged. I don't know how to show this damage. Let's say some kind of, it splits. Okay, so RBCs will be damaged and the contents will be expelled out, including hemoglobin. So hemoglobin, what? It again got split down into, it splits into heme and globin, right? This heme and globin. So globin is a protein chain. As we know, it will go to the amino acid pool and that will happen. What is heme? Heme is an iron complex. Okay. So some of it will go as this iron and it will be recycled, and some of this will become what? Biliverdin and finally bilirubin. Okay, means bile pigment, bilirubin. So biliverdin, bilirubin. Okay, fine. So this is actually what happens in case of yes. Okay, anyway, that much is not necessary now. So what is the result of damaged RBC in the pathogenesis of hemolytic anemia? So in hemolytic anemia, main thing is RBCs will be damaged, hemoglobin will be produced, means released to the bloodstream. So this again result in some clinical manifestations, like first one is anemia, because hemoglobin is not inside RBC, so hemoglobin doesn't carry oxygen and hence anemia is manifested. Next thing is jaundice. Why jaundice? Just now I have shown that this bilirubin is produced. Bilirubin is bile pigments. Whenever the serum bilirubin is increased, it will result in jaundice. Okay. Now next thing is splenomegaly. Splenomegaly will happen. Why is splenomegaly? Okay. So I talked about 1, 2, 3 and 4. Wait. Okay, let's say what is the result? It could be this release of hemoglobin. That's what we are talking about. Damaged RBC damaged means there will be 3 release of hemoglobin will be there, and that release of hemoglobin release could result in 3 manifestations. First manifestation is anemia. Next one is what was that? First manifestation is anemia. Second manifestation is jaundice. Okay. Second manifestation is jaundice. Third one is splenomegaly. So why? Anemia, because anemia. Okay. So anemia. Why anemia? Anemia because hemoglobin is broken down. Heme plus globin. Okay, that's why anemia happens. Next thing, this what was that? Okay, next thing is jaundice. So jaundice means this heme will go converted to bilirubin, bile pigment. So bile increase in the bile pigment, and that results in jaundice. And finally, what is next thing? Next thing is splenomegaly. Why is splenomegaly? So splenomegaly happens because, as you know, spleen is supposed to be the graveyard of RBC, which means RBC is destructed in spleen. So and also in spleen that production also happens. Anyhow, this RBC is broken down, and as you know, in case of this hemolytic anemia, wait a second, let me check it. Yes. So okay. So we know that spleen has a role in removing the removes the damaged RBC. So these kind of damaged RBC will be more in case of hemolytic anemia. So therefore this spleen activity will also be increased. So to compensate for this increased activity, the spleen enlarges in size, which leads to the splenomegaly. That we can elicit that using by the physical examination. So that's it. Okay, fine. Now what else? So next thing is for damaged RBC. We talked about that. Then what is the presentation of mild hemolysis in hemolytic anemia? So in hemolytic anemia, what is the presentation? What is the presentation of hemolysis? So hemolysis, we know. Again, the same thing. We are asking about presentation now. So presentation means fatigue will be there, pale skin will be there. That is anemia. Then mild jaundice, splenomegaly. So in total, we can say anemia, jaundice, splenomegaly, then possibly hemolytic anemia. Hemolytic anemia. Okay, so this is the thing. Seventh question: how does hemolytic anemia affect children? How does hemolytic anemia? How does hemolytic anemia affect children? So affecting children. See, the same thing will happen. Pallor will be there, fatigue will be there, jaundice will be there, and in case of children, we have to understand that they are in their growing phase. See, the other symptoms, whatever symptoms you see, expected to see in adults, that will happen in case of children also. But apart from that, children are in their growing phase. So their cognitive development, everything happens at that age. So because of this anemia, oxygen supply will be decreased, these developing tissues won't get enough nutrients. So what happens? There could be this cognitive impairment. Okay, mental development could decrease, or that could be impaired. Yes. Now what else? What causes hemolytic anemia? So etiology, we are going to the etiology. So we are going to talk about the causes. So causes, actually you can classify it. So let's say causes means there will be genetic causes and there will be acquired causes. What are those genetic causes? So genetic causes, you can say like sickle cell anemia, and you can say infections. Sickle cell anemia, thalassemia. I guess this is the actual pronunciation. I don't know, so don't give much importance to my pronunciation. Anyway, thalassemia. Then what else? G6PD deficiency. That is a very important cause among these genetic causes. Okay, so the last cause is G6PD deficiency. Not G6PD. Okay. G6PD deficiency. What is G6PD? Glucose 6 phosphate dehydrogenase. So there are three genetic causes: sickle cell anemia, thalassemia, G6PD, which is glucose 6 phosphate dehydrogenase. So this is G6PD. So that deficiency could also lead to anemia. So these are hemolytic anemia. So these are the genetic causes. Okay. And again, you can add two more things. Like there will be some kind of shape deformities. by genetically means by birth it will be there. So what is this shape deformities in RBC? So that is also included under the genetic. Okay, that is also included under the genetic. First one is both of them start with the H. Both of them has the first word hereditary. So it could be hereditary spherocytosis, or hereditary elliptocytosis, I guess. Yes, elliptocytosis, hereditary elliptocytosis. So these are the genetic causes. So total 1, 2, 3. 1, 2, 3, 4 and 5. So we were talking about the causes, genetic and acquired will be there, and genetic we told about. We talked about the five genetic causes. 5. That is sickle cell anemia, thalassemia, hereditary spherocytosis, hereditary elliptocytosis, and one thing, G6PD deficiency. G6PD deficiency. Among this, I will give more importance for G6PD deficiency. Others are also important, but this main genetic, most important genetic cause is G6PD deficiency. You can expect a lot of questions from that area. I guess so. Now, acquired causes. Let's talk about the acquired causes. So acquired causes include first one, or very important one, I could say, like the G6PD deficiency in that genetic causes. Here I can tell you autoimmune disease. Okay, autoimmune disease such as autoimmune hemolytic anemia. So we are talking about the acquired cause. Autoimmune hemolytic anemia. Autoimmune hemolytic anemia. Second one, infections. Second one is infections. Infections like so what are those infections? You can tell malaria. Okay, infections like malaria. So second one, first one is autoimmune. Acquired means autoimmune diseases are also included under acquired, and autoimmune diseases like autoimmune hemolytic anemia, and second one infections like malaria. Third one, antibiotics. Certain antibiotics can also result in hemolytic anemia. Which antibiotics? You could say this is cephalosporin and something like that. That I will tell you later. And also antimalarials, antibiotics and antimalarials. Antibiotics, some certain drugs, antibiotics, antimalarials. These can also result in the acquired causes, means acquired anemia. So these are all the causes, and also certain toxin. Then I can also include, there will be some certain conditions of spleen and liver, and that can also result in the acquired anemia. Now, what are what is the etiology of autoimmune hemolytic anemia? So we came to know that autoimmune anemia is supposed to be is the autoimmune anemia is the acquired cause. So it happens in its later period of life, not by birth. It's an acquired cause. So it happens later in life. And now what should I say? Okay, what was her question? Etiology of autoimmune hemolytic anemia. So when talking about the etiology, immune system mistakenly attacks and destroys the red blood cells. See, that is what anyone would usually expect when they heard the name autoimmune, because autoimmune means they are immune to self, means the cells loses ability to differentiate the self from non-self cells. Okay, so in this case what happens, some certain cells will identify RBC as targets. Okay, they think RBCs are some from outside and they will destroy the RBC. What could be the reason? RBCs are from outside. They think RBCs are from outside, they are not from our body, and they will destroy the RBC. What could be the reason? Many reasons could be there. Some people, you can say, some people don't have this proteins, some proteins necessary for RBC membrane. Wait a second, I'll continue. Wait a second, I have to end the session now. I'll continue later.